We're going to do a vestibular ocular motor screening for concussion. First, we're going to take some baseline symptoms. Scale of 0 to 10. Rate your headache.
4.
Dizziness.
6.
Nausea.
2.
Fogginess.
8.
We're going to start off with is smooth pursuits. So you're going to eyes on this X without moving your head. As I move it around, just follow with your eyes. Don't move your head. Okay? All right. Ready?
Yep.
And you're going to continue to do this until I tell you to stop. Okay. So we're going to reassess your symptoms. Did any of those increase at all or change? We'll start with headache.
No.
Dizziness.
6.
Nausea.
2.
Same. Fogginess.
8.
So the next one that we're going to do is called horizontal saccades. I'm going to hold my fingers out. I want you to only moving your eyes. You're going to look at both fingers back and forth. Okay. You're going to do this as fast as you can until I tell you to stop. Okay.
Yep.
All right. Based on the test that we just performed, have any of the symptoms that we discussed earlier changed at all? Headache?
No.
Dizziness?
No.
Nausea?
No.
Fogginess? No. So we're going to do another form of saccades, but it's going to be vertically. So we're going to do essentially the same thing. You're going to move your eyes up and down as fast as you can without moving your head. Okay. Do you understand?
Yep.
Okay. So I'm just going to show you quick. It's just moving your eyes. Make sure your head does not move. Okay. You're going to do this until I tell you to stop.
Okay.
Okay. Go ahead. Based on the test that we just performed, have any of the symptoms that we discussed earlier changed at all? Headache?
No.
Dizziness?
No.
Nausea?
No.
Fogginess? No. Great. This next test is called convergence. I am going to slowly move this popsicle stick towards your nose. I want you to focus on the X. As I move closer, if you start to see double of the X, then please let me know so I can stop. Okay? Great.
Two.
All right, we're going to do this 2 more times. Okay, same thing. Focus on the X.
2.
And last time, same thing.
2.
Based on the test that we just performed, have any of the symptoms that we discussed earlier changed at all? Headache?
No.
Dizziness?
No.
Nausea?
No.
Fogginess? No. So next we're going to do the horizontal vestibular ocular reflex test. So I'm going to hold this popsicle stick still. Want your eyes to focus on the X here, and you are going to move your head. I'm going to start a metronome, so I want your head to follow the beat of that metronome, okay? I don't need you to fully rotate your head, I just want you to go about 20 degrees to both sides, okay? It's going to look something like this. Okay? Alright, and I want you to do this until I say stop. Go ahead. Okay, that's good. Based on the test that we just performed, have any of the symptoms that we discussed earlier changed at all? Headache? Dizziness?
No.
Nausea?
No.
Fogginess? No. Okay, so the next one is almost the same thing. We're just going to go vertical instead of horizontal. So you're going to focus your eyes right here, the X, and following the same beat that you were just given, your head is going to go up and down. Eyes on the X, only the head moves, not the eyes, okay? It'll look like this. Go ahead until I say stop. Okay. Based on the test that we just performed, have any of the symptoms that we discussed earlier changed at all? Headache?
No.
Dizziness?
No.
Nausea?
No.
Fogginess? No. It's called visual motion sensitivity test. Okay. So what I'm going to have you do is stand shoulder width apart with your feet. You're going to have your thumb straight out. Your eyes are going to focus on your thumb the entire time, and you are going to move 80 degrees to the right and 80 degrees to the left. As I play a metronome, I want you to hit the beats on both sides. It's going to look something like this. Okay, sounds good. Great. Go ahead. And I'm going to have you do this until I say stop. Based on the test that we just performed, have any of the symptoms that we discussed earlier changed at all? Headache?
No.
Dizziness?
No.
Nausea?
No.
Fogginess? No.
Prior to an athlete suffering a concussion, neurons are able to dispense neurotransmitters in an organized sequence, prompting the next cell with a specific coded message. The organized sequence within a neuron is performed on a chemical level, allowing for the metabolic breakdown of the nutrients in the brain. Following a concussion, the brain utilizes a neurometabolic cascade, a neuron-specific arrangement of ionic, metabolic, and the functional changes with a microscopic axonal injury. Functional changes within the neuron pertains to potassium ions leaking out of the stretched neuron, resulting in a decrease, hyperglycolysis occurring with hypoglycolysis to follow, toxic calcium ions flooding in, cerebral blood flow decreasing, and the demand for the energy increasing. An influx and discrepancy of these contents within the neuron causes an immense release of neurotransmitters, which disrupts cell communication and a metabolic dysfunction, leading to an energy crisis. In this condition, neurons are extremely vulnerable, and any added stress or injury may result in significant cell damage or cell death. Neurons may take several days to return to normal. Potassium ions increase around 2 minutes and can return to normal around 12 minutes. Hyperglycolysis occurs around 2 minutes and decreases around 20 minutes. Hypoglycolysis occurs after 6 hours and can return to normal around 10 days. Glutamate increases around 2 minutes and can return to normal around 6 minutes. Calcium ions increase around 2 minutes and can return to normal around 6 days. Cerebral blood flow decreases around 2 minutes and can return to normal around 10 days. Energy cannot return to normal until normal metabolic function is restored. Before an athlete gets a concussion or experiences a violent shake of the brain, the nerve cells of the brain function properly. Nerve cells are what send messages to allow our body to perform daily activities such as walking, thinking, breathing, etc. Normal functioning nerve cells contain a specific sequence of stages that triggers the next cell with a specific coded message. This sequence of stages is performed at a chemical level to break down nutrients. The nutrients that are broken down are how the brain gets energy to function properly. When an athlete gets a concussion or experiences a violent shake of the brain, these nerve cells become injured, causing microscopic lesions on the brain and disrupts the brain's function. The injury to the nerve cells results in a large amount of chemical signals being moved in and out of the cells, causing an interference with the way cells communicate. This increase and decrease of chemical signals lead to malfunction of the brain's ability to break down its nutrients. When the brain's nutrients cannot be broken down properly, it causes an inconsistency in the supply and demand of energy that the brain needs, meaning there is not enough energy being provided to the brain for it to function properly. In this condition, nerve cells are extremely at risk, and added stress or injury may result in significant cell damage or cell death. Nerve cells may take several days to return to normal.